Welcome to the Plus Side of Nashville. I'm Tuwanda Coleman. We know regular dental checkups, ideally every 6 months, can help your teeth stay cleaner, last longer, and prevent painful problems from developing. If you have dental insurance, a trip a year to the dentist can typically cost you little to nothing. But for those that are uninsured, those trips may be few and far between because of the affordability. On today's show, we're highlighting the work of an organization that provides oral care to uninsured patients, putting a smile on a lot of faces. The Plus Side of Nashville starts now.
From the News Channel 5 Network, this is the Plus Side of Nashville.
Hi, everybody. Thanks for joining us. Have you ever seen, or you may know someone who covers their mouth when they smile because they're embarrassed to show their teeth? Well, you don't know one should have to hide a smile. 1 in 4 adults in America have untreated tooth decay. Adults who are low income are 2 times more likely to have untreated cavities. But with proper dental care, it is more than likely that those problems can be prevented. But we know that cost. Interfaith Dental is a nonprofit that helps low-income, uninsured people achieve and sustain a healthy smile. And here to tell us more about it is Jeff McCormick. He's the Senior Director of Stewardship for Interfaith Dental. Welcome.
Thank you so much for having us.
Oh, it is my pleasure to be able to talk about Interfaith Dental Clinic and share your story. I just love the work that you all do.
Thank you. Thank you.
And you know, as I mentioned in the open part, your motto is a smile changes everything.
That's right.
And we know that can be so true. Talk about the importance of good oral care and how it can affect your self-esteem and your lifestyle when you don't have it.
Yeah, absolutely. Oral health care is so important, and most people can realize what it means just for their overall health, or maybe they've had a pain in their mouth and they kind of associate with that. But really, oral health is more than health, right? It helps people get better jobs and believe in themselves and look at themselves in the mirror and realize, hey, I can get up and tackle this day. And sometimes when you don't have it and you've got a poor oral health or poor smile, you just don't think you're worthy of much. And we want people to feel like they're important and they're valued. And I think so investing in their smile and investing in a lot more than just health.
Absolutely. And the folks that come to you, we're seeing some of the pictures there. Look at these smiles. You know, once they've been through the Interfaith Dental Clinic and they come out with these smiles, look at these smiles on their faces. So you know that the work that you're doing is great. Talk about the guidelines for if someone comes in and says, you know, I really am not happy with my smile. What are the qualifications for the program?
Absolutely. So we serve folks who experiencing low incomes and are dentally uninsured. And so for us, that means 200% of poverty level or below. And that gets real complicated, based on family size and individuals. We try to serve the biggest population we can. The best way to realize if you think you might qualify, we encourage you to call. Call either one of our clinics. We've got one in Nashville, one in Murfreesboro. And calling and talking to our patient care coordinators can really help them understand, okay, I have an emergency need and we want to see you quicker, or I've got bigger needs and I can put you on a schedule, those kind of things. And so we really just encourage you to call or check us out on the website to figure out those guidelines. But really, it focuses on folks who have barriers to affordable care. And we really want to just strike those barriers down to get them what they need.
There you see the addresses and the phone numbers right there on the screen. There is a location here in Nashville as well as in Rutherford County. So folks in the Murfreesboro area can also receive your services and the phone numbers. This is all such important and valuable information. And often folks, they're not necessarily concerned as much about the cleanings or things of that nature. But we're talking about people who are missing teeth, who have a bad toothache, and the teeth needs to be extracted. So share with us some of the experts and the doctors that you work with.
Yeah, absolutely. The real way to say it is anything that can be done in the mouth, we do. We do it both with paid staff and volunteers. We're really amplified by the volunteer community as well as residents and other workforce. And so we really take every person of value and skill that can dive into the mission and help to do it. And so we've got people who do extractions, do implants, do cleanings, do cavities, root canals, every service you can think about in your mouth we do, because we want someone to be all the way well. And it takes a lot to get there. there, and so we want to offer all we can. And so the 10-county region of that we serve can come to either one of those clinics, and then we're able just to get them well as long as it takes.
You know, and I think a lot of people aren't aware that bad teeth and tooth decay can affect other parts of your body or other parts of your health. Because that can also get into your bloodstream.
Absolutely. So it really exacerbates chronic diseases, and so we look at things like high blood pressure and diabetes and a whole host of other things. And it also goes both ways, right? Sometimes you need good oral health to continue your other health journeys. So people need a clearance for a surgery or a transplant, and they really aren't able to do that until they have overall health, right? And so sometimes hospitals will call us and get referrals and say, like, can you help this person, right? And we say, absolutely, let's get them well. Because it's what they need to further their overall journey. Because poor oral health is really a slippery slope to poor overall health. Yeah. And so we want to keep that up and keep them healthy.
I was curious, and you said that you sometimes get referrals, because I was curious, how do people find out about you?
Well, here's the real cheesy way. You want to hear it?
Yes.
It's word of mouth. It's word of mouth. But I know, right? But it really is. It's neighbors telling neighbors. I got well, and telling somebody else. A lot of referrals from other agencies in town. So I guess I mentioned hospitals, but also other nonprofit agencies who's already working with a client and says, hey, they really need help. So people just find us on the good old Google search, right? However they can find us, we just want to, step in and kind of be the spoke in the wheel that stops them and says, let's get you well.
Jeff, how many people on an average would you say that you all serve per year?
Yeah, so this last year we served 3,300 people. They had 12,000 visits, and that equated to about $8 million in market value of care. And so it takes a lot of hands to do that. And so, like I told you, it's paid staff, it's volunteer staff, it's donors and community members supporting this effort. So it's a lot of hands to make it happen. But our goal this year is to serve 3,500, and we've going to do that with the community support.
That is amazing. When you think about that, over 3,000 people coming in, and we've got the dentist on hand who are they volunteering their services?
That's right. So we have paid staff that kind of continue that care, and every single day of the week we've got volunteers that come in. And so general dentists, specialists, oral surgeons, all line that can come in. Many serve inside of our clinic. Some serve in their own private practices. And so we just make it. If a volunteer wants to volunteer, we're going to find a way to make it happen, right? Because we know it helps the next person in need. And so those volunteers really amplify the care for us.
I love that. And you have several programs that sort of specialize in certain areas, such as our seniors, which we love our seniors, of course. And then so you have a program, I think it's called Smile 65 Plus?
Smile On 65 Plus. And so this is a program that is in partnership actually with state government to help us fund this. And so we focus on older adults. This is a statewide program that we started. We are a provider in Middle Tennessee, but there's also providers around the state, and focusing on the needs of seniors. Not only is it the care, but it's sometimes getting there, transportation to get there. It's sometimes the barrier of thinking like, I don't know if I qualify, and a lot of our seniors, they kind of sit back and think, there's nothing for me, right?
Exactly.
But there is, and we want to make you all the well, because getting that senior well changes. Now I'm eating nutritious food. Now I'm ready to go out in the community and interact. Many of them, they don't talk to people. They stay in their homes, and then that just is a cycle for a lot of other terrible things that can happen, right?
Really
and so getting them well making our seniors smile is a beautiful thing. We love working with our seniors.
Yeah, we love making our seniors smile. We got to take a break, Jeff.
Absolutely.
And when we come back, we'll have more with Interfaith Dental. So stay with us.